As a pediatric neurosurgeon, we are searching for tools which minimize the morbidity and the risk of damaging the neural structure or the dura. This tool allows to do the osteotomy with the minimal risk of damaging the underlying structures.
So we were trying to find a new instrument where we could achieve a bone craniotomy or a spine laminectomy without losing bone tissue.
So pediatric neurosurgery is dealing sometimes with very delicate bone and delicate bone cutting, for example in cranial deformities, but also in spinal surgery. And we were looking for instruments that were very well steerable and had probably also very thin bone cuts.
But I need to have fine cut during the osteotomy. I perform craniotomy for pediatric brain tumor, for example, or laminotomy for spinal cord tumors, other than many operations in craniofacial surgery. So I needed an instrument to perform fine cut by respecting the bone and by having possibly a clear surgical field.
Usually for the bone cutting in the osteotomy for craniofacial surgeries, but also for the spinal procedure, for doing the laminotomies, for approaching intradural lesions.
We use it mostly for craniotomy, either supratentorial and infratentorial, and also for spine surgery, mostly for tumors.
Actually, we have experience in using it with craniofacial deformities, and we are also using it when we are trying to harvest split bone grafts in the calvaria, and we more or less regularly use it for performing laminotomies in spinal surgery.
Because I had the opportunity to go faster and to be more precise, for example, in the orbitotomy during craniofacial surgery, or for some approaches such as the front-orbitozygomatic approach. So I had the possibility to go deeper during the operation, but also to be safer against the soft tissues.
I think the best advantage is in cosmetic results, since the bone loss in the craniotomy and in the laminectomy it's so thin, we have an easier repair of the bone itself.
So you are having a very nice control over your bone cutting and bone modeling. This is first for the quality of your bone cutting an advantage, and also I think in certain aspects it is an advantage in respects of safety, especially when you are thinking of cutting the dura, which you would like to avoid in, of course, most of the surgeries.
The osteotomy line is very thin, and the reossification is also very good. And these are advantages that are particularly useful in children and for all the craniofacial surgical procedures, and for also the spinal procedures, which allow for a good reossification and stabilization.
Yes, the main ones are the possibility to spare the bone. This is very important when you operate on region like the front orbital one that has an important cosmetic impact for the patients, and also to obtain a fast bone healing that is important for every kind of patients or every kind of locations.